All right, so good morning, everybody. It looks like it's just a couple minutes after 10:30. For all of you that are joining us, thank you. Today our webinar will be focused on advanced healthcare directives, and our panelist speakers will be Dr. Scott Neeley, Vice President and Chief Medical Officer for Hospice or St. Joseph's Medical Center. And then also we have Reverend Gerry Grossman, who's the Program Manager for the San Joaquin County. Our next slide here will show attendees how to ask a question. So at the end of this webinar, we will be opening up a forum to ask any questions you may have about the information that is presented today. As you can see, there is a small chat box at the bottom right-hand side of the bar for your attendee window. And all you'll need to do is type in your question and press enter, and then we as panelists will be able to see your question and answer anything you may want to ask. Again, thank you for joining us, and we'll get started right away here with Dr. Neeley's presentation on advanced healthcare directives.
Okay. I'm Scott Neeley, and I'm a physician, my area of specialty is critical care. I've been doing that for a little over 30 years, and I suppose the question might come up, why is somebody whose clinical specialty is critical care coming on this to talk about advanced directives? So, you know, I think it's always good to start with a funny picture. But I'm going to start by talking about the gorilla in the room. And it really is the big gorilla in the room, because what I'm going to talk about is the fact that for all of us, our lives come to an end. Can I go to the next slide, please? You know, we live these lives with so much content, so much happiness, so much pain, so much wonder, so much fear, sadness, love, all of the elements of these lives. And in many instances, we live these lives ignoring, or at least trying to ignore the fact that we all grow old, our bodies change and work less well than they used to. For many of us, we become ill or we become injured, or we have other challenges having to do with our health. And for all of us, eventually, our lives end in one way or another. And it's the 900-pound gorilla, because while we perhaps in many instances attempt to ignore these difficult facts, we can take an entirely different approach and actually have a tremendous amount of agency and a tremendous amount of control over this thing that in many instances feels like something that's perhaps outside of our control. Can I go to the next slide, please, Francis? So, as an ICU specialist, one of the things that I've come to recognize is that very severe illness, the type of illness that oftentimes can result in somebody ending up in one of my intensive care units, that kind of illness can essentially have one of two outcomes. The first is intensive treatment with improvement or stabilization. And for those of us who make, for example, ICU medicine or high-risk surgery, trauma surgery, some of these other sort of high-stakes specialties are clinical practice, this is to some extent what we live for. We can care for a patient who's encountered an illness that might cut a life short, prematurely end a life, and in some instances come up with a cure or at least with an improvement that results in a return to a high quality life. And that is, for many of us in medicine, what we live for. You know, illnesses like this can end up with other types of improvement or stabilization. So even without a cure, a person might come through an illness with some degree of disability or dependence on others for care, but continue to have quality of life. And so quality of life does not depend on a complete and utter cure, but improvement, stabilization, getting to a place where the enjoyment in life returns, where we can perhaps enjoy companionship with those we love, enjoy some of the things that we love to do, maybe learn to love some different things if limitations occur in our life. But that's the first type of outcome that can occur as a result of severe illness. There's a second general outcome from severe illness that, for me personally, and I think for many people who practice in my specialty, is a very challenging and, as a caregiver, painful type of outcome, that being, number one, end of life, or in some instances, prolonged dependence on life-sustaining treatment. This is an outcome that occurs when improvement, stabilization, or even cure is not available, but when we've truly come to the natural end of a person's life. And when that occurs, we essentially have the choice at times of either allowing a natural death or, in some instances, to prolong that human being's existence with life-sustaining treatment. And that is a very challenging and oftentimes painful outcome. It's painful because we experience the difficulty in letting go and facing that reality. And it's also painful because in many instances, this type of treatment does not do anything to enhance life, to return quality of life, but in fact, prolong suffering. And it's for that reason that I view this as one of the most difficult outcomes that results from severe life-threatening illness. And if we could just go on to the next slide, I would say that part of the reason that I'm so passionate about this particular type of work, and particularly about giving people choices in their lives, is that these intensive treatments that are, miraculous, and which in many instances give people years of life back, when they are applied to a situation where the person has reached the end of their natural life, they prolong suffering. And this could be this photograph could be any one of a number of people who are currently living in our county, who are not able to care for themselves, who are severely ill, whose very existence depends on prolongation of their life with, in this case, a mechanical ventilator that's hooked to a breathing tube in the throat, to a feeding tube that enters this patient through an opening in their abdomen. This gentleman has a very severe neurologic condition and is completely dependent for all of his care. He cannot cough on his own. He cannot swallow. He cannot recognize his loved ones. He cannot breathe on his own. And he's unable to really communicate with or enjoy the company of the people around him. You know, this type of care is challenging for all of us. I think it's very challenging for the loved ones of patients like this. In many cases, they are hurting, they're aching, they're experiencing the loss of this loved one, and they're, in many cases, expressing that love, that caring, by insisting that all medical treatments to prolong life continue despite the person's condition and despite the person's inability to really experience life as we know it. And you know, what I wanted to point out here is not only the fact that the use of medical treatment in instances like this can prolong suffering, but in my personal experience, in almost all instances in which we see this type of care continuing, the individual did not express their own wishes for how they wanted to be cared for prior to their illness. We see rare instances of individuals who actually give us a preference of, yes, whatever it takes, whatever technology is available, I want my life prolonged regardless of my quality of life, regardless of whether I'm conscious or not. We do occasionally meet people who express this type of a preference, but it's actually extremely rare. And in almost every instance where I personally have been involved in caring for a patient like this, it's a situation where loved ones are left struggling to make decisions about how to care for somebody that they love very deeply, and that person never actually expressed a preference for how they wanted to be cared for. And I think in many instances, the love that family members have for these individuals is actually being deferred into the continued demands for more medical treatment, for more medications and equipment and procedures to prolong the individual's life. Sometimes there may be an unrealistic hope that a true recovery will occur, although in most instances it's more of a deferral of that family or that individual's love for the patient, and that combined with the patient having not given clear instructions as to how they want to be cared for results in these situations. I can tell you they're painful for family members, they're painful for caregivers, and I can only imagine, or at least try to imagine, what it's like to be in this situation as a patient. Can I go on to the next slide, please? So we're going to talk a little bit today about respecting choices and the profound value that occurs when we let people know how we want to be cared for at the end of our lives. It begins with knowing and honoring an individual's wishes for how they want to be cared for at the end of their life. Do they want their life to be allowed to end naturally with every possible measure taken to preserve dignity, to alleviate suffering? But more importantly, how do we alleviate the burden of these quote-unquote life or death decisions for loved ones? Because this is what we're running into in so many of these instances. By making a choice, by communicating that choice, by having that conversation with loved ones, and by leaving clear direction in the form of legally binding tools, we take away that entire burden of these apparent life or death decisions, and allow people to say, you know what, we did exactly what she wanted. We took care of him in exactly the way that he wanted to be cared for at the end of his life. This is a tremendous gift, not only to oneself, but a tremendous gift to our loved ones, and giving them clear direction and giving them resolution so they know that the individual was cared for in the manner that they wanted to be cared for. And hopefully in most instances, the use of these tools results in alleviation of suffering and dignity for the individual. Always the focus is on the entire person and how the entire person wants that life to look at the end, as opposed to these very narrow therapeutic approaches to life, which have everything to do with technology and medical care and a disease-oriented approach, and nothing to do with focusing on a whole human being and allowing that whole human being to have agency and to have power over their life, even as we're facing these inevitable and difficult realities, the gorilla in the room. So that to me is the why. I know Francis and Gerry are going to be talking about the how, some mechanisms that we, with the Coalition for Compassionate Care, champion here in San Joaquin. But it all starts with the why and the imperative for using tools like this, both to have impact over our own lives and also to give guidance and comfort to the people that we love when we do reach that time in our lives where we are challenged with these physical conditions. So I'll just stop there and turn it over to Francis Sandor.
For those words and for speaking about end of life and the point that we all one day will come to in one manner or another. I think it's especially important to note the struggles that families we often see face when they are left to make these decisions for their loved ones. And I know in our line of work at Hospice of San Joaquin, we frequently encounter that while not only the patient does suffer through some of these really intensive services in intensive care units and in the hospital, it really leaves the family with complex grieving. Not only are they mourning the loss of their loved one, but then there are all these challenges surrounding, did they do what they should have done? Did they do too much? Did they do too little? So I know that we deal with frequently family members or loved ones who are left really with a complex grieving situation when some of these end up prior to events that put a person in that place. So thank you very much for speaking on that. And then my part of this presentation will really focus on once you've navigated how you would like to manage your healthcare, if you've elected to have an advanced healthcare directive or to complete a Polst, what's available in the community? What resources are there when your goals of care change and your medical treatment changes a little bit as well? So we'll jump right into that. At Hospice of San Joaquin, we have 3 unique programs that really fit different care needs for all patients and family members and loved ones. And I think each program focuses a little bit different in terms of what place people are at in their journey. We have first our transitions program, which is just mostly companionship, phone support. Part of this program really is available to people who may have a chronic condition or illness, but they're still living a high quality life. This service really provides support, answers questions, and then also is there to give people access to resources in the community, and there's no obligation. There's no cost to it. and it's available for anybody over 18 who may need this type of support in navigating the healthcare system. So next, we have our Pacific Palliative Care Program. So for patients who have chronic disease and illness but are still under the care of a specialist or an oncologist, cardiologist, pulmonologist, etc., we are available to support them at home in addition to the care that they're getting in clinic or outpatient services, or even at times when they do need to enter the hospital for an acute care need. Patients are able to pursue both aggressive therapies and treatments, as well as get kind of the emotional psychosocial support of a nurse, a social worker, and a chaplain. Our palliative care program is available to many people, and if you have questions or concerns about enrollment, you can certainly call Hospice of San Joaquin and get those questions answered. The palliative care program also has a 24-hour on-call component to it. So many patients, as we know, when they're faced with a life-limiting illness or a chronic disease, the support isn't just necessary Monday through Friday when the clinic's open or when the physician's office is open. So a palliative care program is really wonderful in the sense that it collaborates with the patient's healthcare team who's covering their cardiac needs or respiratory needs. And then in addition to the palliative care program, that the support of a patient really isn't just during those clinic hours, but at all times. In addition to nursing support, social services, we know it's a really big factor when navigating end-of-life choices and making decisions about healthcare when we're faced with chronic illness. So our social services department can really support not only the patient, but also their loved ones who are equally dealing with navigating the situation and going through their own sort of emotional issues. And then additionally, that program offers spiritual support. So we know that as people navigate their healthcare journey, and maybe the clinical aspects of their care change in some way, we know that the spiritual care needs oftentimes do elevate. So a palliative care program really cares for the whole person in totality, in addition to their family members. And then lastly, the most comprehensive support program that is available to people who are facing life-limiting and chronic disease, we have our hospice care program. The hospice Medicare benefit, or the hospice benefit for any person, is really a robust program that offers huge benefits, not only to the patient, but to the family. Many people don't know that this benefit is available to them. And then additionally, they don't always know how comprehensive it really is. In referring to Dr. Neeley's conversation, when we're empowered and educated to make choices about our end-of-life journey in whatever way we get to that point, we also have the decision to decide where that journey takes place. And making those educated, empowered decisions, we can have a really beautiful end-of-life experience wherever it is that we call hospital, connected to all these tubes and advanced medical care. So a hospice program is really in place to support the patient and the family through their journey. And that includes pain and symptom management, medications, durable medical equipment, a hospice nurse, a home health aide, a chaplain, a social worker, respite care. Here at Hospice of San Joaquin, we have our inpatient unit for pain and symptom management. And then also we have crisis care. So I think a lot of times there can be some anxiety around making informed healthcare decisions at end of life because you're not sure of the support or programs that are available and accessible in the community. So today, my goal is really to inform all of you about the care programs that are available and also empower everyone to make informed, educated decisions about their when faced with chronic disease and illness. So there definitely are a lot of programs in the community. And like I said, a transitions, palliative, or hospice care support can be a huge benefit to not only the patient, but the family in navigating some of these end-of-life situations. So from here, I will turn it over to Gerry, who is the program manager for the San Joaquin County Coalition for Compassionate Care. And Gerry, here you go.
Good morning, everyone. Thank you for having me here. If you can just put my first slide up, that would be great. And so what I want to talk with you today, we've heard the word navigate a few times in planning and such. And if you're going to launch out and you're going to navigate, and especially your healthcare, you're going to need a plan, you're going to need a roadmap. And the best way to do that, we feel, is to start by determining what your values are. What's important to me? What is important to those whom I love and those who love me that I need to put down on a piece of paper just for myself. This isn't necessarily something that you're not going to share this with your doctor or your healthcare workers. Hopefully you'll share this with your family members and your loved ones so that they have an understanding of why you are going to fill out an advanced care directive, which we'll get to momentarily, the way you're going to fill it out. And so the values worksheet, and by the way, all of these documents I'm speaking of here are available through our website, which I'll give you the address, and that is www.sanjoaquincccc.org. And you can download these forms from there, and you can give us a call, and we'll be happy to work with you over the phone on them, especially in this time of dealing with COVID-19, or we can work with you via email on them. But they're all available, and our assistance is all at no charge. I also do want to mention right away that if you are viewing this from outside of the state of California, you should contact your healthcare provider in the state that you are in, because these forms do vary from state to state. And so that's really important that you understand that the forms I'm speaking of today are specific to the state of California. So the first thing we do is we want to start with a values worksheet. We want to let people know what matters most to me, what matters most about the quality of my life. What are the circumstances around my life and my healthcare that I need you to know? What happens, what do I want to have happen in the event that I cannot speak for myself? How do I want to live in that season of my life? And so we begin that by going through this values worksheet. We talk about, and you will be asked about such things as, if you're going to have a meaningful day, what would that look like? What are the aspects of your life that are important to you that you want to be able to continue? I want to talk about spiritual beliefs. What are my cultural beliefs that have an impact on my medical decision making? And then on to other things, future events, lessons I've learned. What are medical treatments that I do and don't want for myself? Perhaps I've seen others, I've seen family members and loved ones go through some medical experiences that I think have benefit and that I think I just don't want in my life. And then of course, what are the fears surrounding end of life and death? And then number 8, what type of care would I like to receive in this season? I really think that in order to fill out an advanced care directive properly, you need to identify your values first of all. Because an advanced care directive, as we like to say at the coalition, it's that place where your values and your healthcare meet. And so you really cannot separate one from the other. You need to understand your values. You need to then be able to relay that information to your loved ones, and we'll do that via an advanced care directive. Next slide, please. Okay, then there's 2 more questions with regards to who are the individuals I would like present during my final days, and where do I want to spend my final days? Often people don't get to make that known. Perhaps when it comes to that season of my life, I would prefer to be at home. Or perhaps in that season of my life, I would prefer to be in a skilled nursing facility, in a hospital, in a hospice facility. But I need to make that known. Okay, then if you look at the next page on the screen right now, these are the directions for the Advanced Healthcare Directive. There's a few parts in it. There's part A, which is who's your healthcare agent? How will you pick who that agent is? Who can you pick? Who you cannot pick to be that healthcare agent? A healthcare agent generally has to be someone who you trust to adhere to your Advanced Healthcare Directive, irrespective of how they might feel about your healthcare. It's going to be someone you're going to have a long and deep-hearted conversation with regards to what you want, and knowing that they will honor what you want. And even if they disagree with you, that's really what you need to understand. Is that person able to assist the medical community with keeping your decisions? Can they handle the potential pressure of staying in line with what you wish to have? Then the next piece, part B, is the instructions for healthcare. And this we'll talk about specific instructions you wish to give the doctors, the healthcare providers, with regards to life-sustaining treatment, artificial nutrition and hydration, and pain management. If you go to the next slide, please, Francis. Donations of organs at death. This is important because you may or may not wish to donate your organs, and it's important to know that right away, and for the medical community to know that right away. You have the right to donate organs. You have the right not to donate organs. No one's going to pressure you into it, but your wishes need to be made known. And then you have the option to designate a physician to have primary responsibility. Who is your treating physician? Who is your primary physician? And then finally, the signature portion of the form. And this is the witness portion of the form, which we'll go into when we get to that page, when we get to part E. So the Advanced Healthcare Directive. First of all, if you look in the top right-hand corner, you'll see a little red box on there. This is where you need to distribute copies of this once it's completed. You should know that a copy is as valid and carries as much weight as the original. So a Xerox copy of a signed form with regards to an Advanced Healthcare Directive is as valid as the signed original copy as well. We ask that you give a copy to your primary care physician, that your healthcare agent have a copy, and that you have a copy readily available in your home. And if you are in a position where you need to have a Polst available, keep this with that. Keep them together in your home. Lots of people, what they do is they keep them in a clear envelope, a plastic envelope, and they attach it to their refrigerator. Many first responders know that when they step into someone's house, the first place they go to is a refrigerator, and they look for these types of forms. And so have those available. Make sure that people that you live with know where they are if you choose to stick it in a desk drawer or someplace like that. Okay, so when you fill the form out, of course, you're going to put your name, your date of birth, and the date that you complete the form. You're going to have, first we go to part A, and this is where you designate who your healthcare agent is, and you're going to just complete that information with them. Again, if you need to have some assistance with how to choose your healthcare agent, give us a call. We'll tell you how to have that conversation. We'll assist you through that conversation. We can actually assist you in person if you want to have that conversation in person with your healthcare agent. We'll be there for you to assist with that. And then, so you want to have a first healthcare agent, your primary agent, and then your secondary agent if in the event they cannot reach the first agent. You want to have that. And then you want to even have a third agent, just to be safe, just to cover all bases. And so you then have an alternate agent, as we call it, which is the third name listed on this page. Okay, next page, please. Next page, Francis. Thank you. There we go. Thank you very much. Now, the next thing you're going to do is you're going to be able to give the agent authority. You're going to determine to what degree regarding your healthcare you're going to give them authority. Are you give them complete authority if you're unable to speak for yourself? Are you going to give them only partial authority, and except as you state on this form right here? So question A2 is regarding the level of authority you're giving your agent. There's also a very last page on this form, which is a blank page, which is for you can put additional information as well. When does my agent's authority become effective? Okay, my agent's authority becomes effective when my treating physician determines I'm no longer able to make my healthcare decisions. If you initial that, that's exactly when that occurs. Excuse me, unless you initial that. I'm sorry, I have that backwards. My mistake, forgive me. You can make that, you can give that person the authority the moment you're entered in under medical care, under a treating physician. You can give them that permission straight away. And then we go to the agent's obligations. And what are the agent's obligations on this form, which Part B will talk about? You can also give your agent post-death authority. If you have specific wishes due to your faith or your culture, or perhaps you've prepaid for any number of things in your life with regards to a funeral or a funeral home, you can put that in this form here. You can put that there, right there. And people, your loved ones don't have to figure that out. They know that you've taken care of that. If a conservator of your person needs to be appointed by the court, you can nominate who you wish to be that conservator if the primary agent is not the willing person. And then we go to Part B, and that is the instructions for healthcare. Now, again, as it says right there, you can strike out any wording you don't agree with or don't wish to utilize. So right then and there, you are now given complete control over your healthcare decisions. So you're going to have, first you'll have some options regarding end of life decisions with regards to how long do I wish to have my life prolonged artificially, or do I not wish to have my life prolonged artificially, as Dr. Neeley was speaking earlier of respirators and feeding tubes and such. B2, the question is, I request relief for pain. Again, this is where really all of these questions reflect upon your value statement. For some, there will be a request for relief from pain. For others, there may not be. And then again, other wishes. If in fact, under other wishes there, so let's just say you do not wish to have CPR, or you want a do not resuscitate order if something happens in your home and first responders show up. You need to then have a Polst form, P-O-L-S-T, physician order for life-sustaining treatment form completed, and that should be done by you and your doctor together. And then that form tells the first responders that they have permission not to resuscitate you, but that they must have a doctor-signed form. Just signing this form and saying that is not enough. It does not cover them legally, and so therefore they'll need to have that form completed by the doctor. It's always printed on a bright pink piece of paper so that anyone who's either looking through a medical chart or again through forms on your refrigerator will know exactly which form is the Polst. Okay, the next page, please. And then Part C also continues with donation of organs. I don't wish to give any. I give anything needed, only specific. And then you can also specify specifically how you would like any donations that you choose to give utilized for transplant, for therapy, for research, or for education. Okay, so you're able to circle that. If you wish to have a treating physician specified, you would do that on Part D1. And then Part E is where you sign this form then. You sign off on this form. Now, the next part we're going to start with E3 there is the witnesses. Witnesses are, there's some very specific rules and laws with regards to the witnesses on this form. You have to know who that person is. They have to know who you are. A next door neighbor, perhaps myself or one of my associates from the coalition comes out and helps you fill out the form. Someone that you know that can vouch for, yes, you are who you say you are. I've looked at your driver's license. Yes, you're you. I would have to make sure, or the witness has to know that you signed the form in their presence. So when you sign on line E2, sign it in the presence of your witnesses. They have to be of sound mind, under no duress or fraud or any undue influence. It's not a person appointed as the agent, as one of your healthcare agents. So it cannot be your healthcare agent can be your spouse, can be a nephew, a niece, a son or a daughter, but they cannot witness the form as well. And then also, no one who is in your healthcare circle, shall we say, or an individual can be a witness to this form, okay? Or no one who works in a healthcare facility that you may happen to be in can be part of this form. And then, of course, the witness also declares that they are a legal adult. So it's important that you understand that that person who is your witness cannot have any sort of health or fiduciary interest in your life or in your estate. And although advanced care directives do not deal with money or property, they want to ensure your own safety with regards to your estate. And so no one who has any involvement in your estate can be a witness. You need a first witness and a second witness. And then you'll get to E4, and E4 will be that the witnesses have an additional statement that says, yes, I am in line, as it were, and I am obeying all of the laws and all of the information regarding who a witness is and what a witness can do and cannot do. And so they're signing that statement as well. You should also know that for the most part, from this point forward, your witnesses aren't going to be involved in your health care. They're not going to be contacted to make health decisions for you. They are simply there to legally identify that, yes, you are you, and you're signing this form. And that's really what a witness does. So if your witnesses are concerned that they have to make healthcare decisions, you can assure them that they do not have to. There's no involvement in your healthcare beyond signing this form and you stating who you are. And then to the next page, please. And then in the chance that you are in, say, a skilled nursing facility or a hospice center, the patient ombudsman or patient advocate needs to sign this form as well, and they'll sign it under Part F. And as far as a notary public goes, that's only needed if you can only find one witness. If you can only find one witness, then the notary public can step in and be the other witness, the other legal witness too. And so this form has all of the information and all of the text that a notary would need in order to sign it and have their signature and their seal on this form be legal as that second witness. Okay, and then finally, the last page, and you can use as many pages as you wish, additional writing space. If you have specific thoughts, plans, decisions that you've made that we didn't cover on this form, by all means, put them here on this page. And I know that everyone who's working with you and for you will do their best to honor those wishes for you as well. And then it also alleviates for your loved ones any sorts of choices or decisions that they may find themselves at odds with regards to your health care or any plans that you'd like to have fulfilled for your life. And so, you know, I would recommend that once you get one of these forms completed, you do talk with your family. You do let them know, I've completed this advanced healthcare directives, and these are my wishes. And therefore, this is what I want you to do. I don't want you to fight over it. I don't want you to argue over it. I want you to go and honor my wishes. All right, thank you very much. Francis, I'll turn it back to you.
Okay, so we'll open up for questions at this time. Again, if you have a question to ask, you can simply type it in the Q&A discussion question box. I know when I was first introduced to the coalition, Gerry, just to start, I know that I had some questions in regards to the coalition and the services you provide. So we'll start with our first question here. The question comes from Rosa, and it is, when witnesses witness your signature, do you have to share parts A through C or only signature?
They only have to witness that you're signing the form and that you are you. And they don't need to know what your healthcare wishes are. That's between you, your healthcare providers, and your healthcare agents, or your proxies as they're called. They don't need to know any of the other information. You don't have to share any of that with them.
All right. And Rosa says, thank you, Gerry. And that was a great question. I know that a lot of these choices we're making about our care are very personal and unique. So great question. I think there is a certain amount of privacy that people certainly would want to have in regards to their advanced healthcare directives.
Absolutely.
Definitely. Now, Gerry, I know when, like I said, I was introduced to the coalition, some questions I had really surrounded what kind of services you guys provide, at what location, and kind of how you engage with people and help them navigate completing an advanced healthcare directive.
Oh, thank you. Well, we have a number of different ways that we can engage people and help them help them complete forms and navigate the forms. First of all, we do offer, of course, drop-in services at our offices every Wednesday afternoon. Once we get past this quarantine season, we'll be opening back up again for drop-in hours. People can give us a call and say, on a Wednesday afternoon, and say, I'm coming by, and we'll be happy to sit down with them and go over the form. And if they need to complete the form, just so you know that my Maypaw Thor, who is my project coordinator, the two of us are actually able to witness forms as well. And so we can witness forms for people as well. We also offer for those that are homebound or perhaps they're in a skilled nursing facility, we can come by and we can assist people and completing their forms with them, and again, witnessing forms for them. We also speak and engage through public agencies and public organizations. We've spoken at a number of public libraries. We speak to many community organizations and such. And in fact, if you have a community organization that you'd like for us to come and speak at, we would be more than happy to come and do that. I want you to know that all of our services are at no charge, and all of our services currently occur within San Joaquin County only.
Wonderful. So it looks like we have another question, and that is, how long is the healthcare directive good for?
It is good until you decide to make changes for it. So it is, from the day you sign it, it is valid forever, essentially, unless you choose to make changes. If you do choose to make changes, of course, then, you know, hopefully you will discard any previously completed ones. If a doctor or your first responder finds two different ones in the house, they're going to check the dates and take the most recently dated one as the valid one. A new form negates all previous forms.
All right, wonderful. Next, we have, when was the Polst form last revised? If the Advanced Healthcare Directive is part of a living trust, should the form you presented be completed also?
When was it last revised? Oh, Dr. Neeley, perhaps you can answer that regarding the Polst form? We don't have your audio, Doctor.
I have to figure out which mute button I have to click. I don't know when the Polst form was last revised. I have a feeling there's been a recent minor revision, but I would have to look that up. Yeah, it's probably a good idea. You know, Gerald, you talked about the fact that advanced directives are good for as long as you haven't revised them, but I think that it's, generally speaking, a good idea to review these documents annually or at least periodically. These are very weighty documents that can have a very big impact on your life. And so I think that it's important to review them regularly. And I think that's particularly important for a Polst form. And I think you covered this, Gerry, but I don't think that we can overemphasize the distinction between an advanced directive and a Polst form because they are very different types of documents, even though they sort of, you know, cross purposes at least to some extent. A Polst form is actually a signed medical order, and it's signed by a physician. and it can be adhered to by any provider, regardless of the of your physical location. So, for example, people who have Polst forms and, for example, who do not want to be, resuscitated in the event that their heart stops, may oftentimes have those on the fridge with a magnet or something like that. But, recognize that the Polst form is a physician's order. So it's an order for medical care, and physicians and healthcare providers take those orders very seriously. They're a distinct entity, whereas an advanced directive may or may not include a Polst as part of it, but expresses your wishes for how you want to be cared for when you become ill, but doesn't have the same legal standing as a physician's order. And so it's a very good idea to, if you have a Polst or even, just an advanced directive, it's a very good idea to review those periodically and make sure that those are still consistent with your wishes and how you want to be cared for.
Thank you, Dr. Neeley and Gerry. And then Beverly, I just wanted to speak a little bit that I think there are several prepared forms and documents that address the advanced healthcare directives. So I think when choosing the forms that you would choose to complete, I would just definitely recommend selecting the form that most accurately addresses your goals as you approach end of life. So we'll move to the next question. And it looks like, Dr. Neeley, you are going to take this question. The question is,
can the Polst form supersede desires listed in a valid advanced healthcare directive? I'm probably getting the echo from your line, Francis, but the Polst form is an order for care. And so it's going to, if a paramedic, for example, or an emergency room physician is presented with your Polst form, they're going to follow what's on the Polst form. And the Polst form is very mechanical. It says exactly what you want. It has reference to things like feeding tubes. It has reference to whether you want to get chest compressions in the event that your heart stops, or electrical shocks to your chest in the event that your heart stops. So it's a very practical and mechanical form that talks about specifically the elements of care that you want or do not want if you're in a life-threatening situation. The advanced directive is a much more complex form in most cases and expresses more, Gerry, you can chime in here, but I think that in many instances, the advanced directive expresses your values as a person and the way that you want to be cared for, but it's not a physician's order saying, either do provide full resuscitative care or do not provide full resuscitative care. And so they're complementary documents, but they don't do the same thing.
Right. Go ahead.
Go ahead, Gerry.
Yeah, I was going to say that the advanced care directive also really part of what it does is it includes your loved ones so that they know what your wishes are, and that they're involved in that to the extent that you allow it on the form, but that they also know what your wishes are with regards to that season of your life and how you wish to live it out. And so it is different from the Polst in that respect. Like as Dr. Neeley says, the Polst is very clear. There's no gray area on a Polst form. Let's put it that way. There can be some gray area perhaps in an advanced care directive.
The next question is really interesting. I understand that if a Polst form is signed by an individual, then that person loses capacity. The power of attorney cannot upgrade their level of care. That is not completely true, at least according to my understanding. And Gerry, you spend more time with this, but if a person is completely empowered as a healthcare power of attorney, and an individual becomes incapacitated, that healthcare power of attorney has complete decision-making rights in terms of that person's medical plan of care. And that means that that person can override a Polst. Now, if an emergency room physician is presented with a Polst form, in California, they are supposed to follow the instructions on that Polst form. But if your healthcare power of attorney shows up and says, you know what, I had a conversation with him just before this happened, and he changed his mind, or you know, I don't think that's in his best interest, and I am a fully empowered healthcare power of attorney, that individual can change the orders on a Polst form.
Correct. Yes.
So that's, you know, making somebody your designated healthcare power of attorney is a pretty big deal, because if you do become incapacitated, they have decision-making power over you know, your medical plan of care. They have the ability to consent for procedures or to decline to consent for procedures. They have the power to change your healthcare Polst form. So, you know, having a healthcare power of attorney is incredibly important, and it does so much in terms of allowing healthcare providers, physicians, hospitals to actually care for you, to do it efficiently, and to do it in a way that's consistent with the way that you want to be cared for. But that individual also has a great deal of agency over how you're cared for, including reversing your Polst form.
All right.
There's a question about whether the Polst form is recognized by all hospitals. The decision as to whether Polst forms are recognized is done on a state-by-state basis. And in California, the Polst document is recognized as a legally binding medical order. And it must be followed by all hospitals, all healthcare providers.
And it looks like we have a clarification. So Regina says, just to clarify on the above question, so what if the person is not a DPOA, they're just a surrogate medical decision maker?
If it's an informed, now we recognize two types of medical surrogates. We oftentimes recognize informal surrogates. You know, that's sort of the next of kin person. You know, you're usually your closest, most connected relative can be a surrogate decision maker without a recognized power of attorney. That person cannot change your Polst form. So there's either a formally recognized surrogate is a healthcare power of attorney, and that person, if they've got the documentation that they are your healthcare power of attorney, can change your Polst form. Your next of kin cannot.
Thank you, Dr. Neeley. All right, and our next question says, assuming we can all travel again, is it advisable to carry a Polst form and or to add to that an advanced healthcare directive?
I think that's a great idea, particularly advanced directive. A Polst form is a terrific document, but it is particularly important when you do not want some type of care. Generally speaking, if you present to a healthcare organization and you're very ill, they are going to operate with the assumption that you will receive all available care, unless there are specific directions not to do something. So, you know, if you're a normal, healthy individual and you want everything possible done to prolong your life, should you become, you know, very ill or are injured, a Polst form is not nearly as important of a document as it is if you, for example, do not want something done, in which case, not only is it advisable for you to have your Polst form at least accessible, but things like medical bracelets and things like that can become, you know, very important. Having your healthcare power of attorney at least accessible is a great idea. It's obviously not possible to pull it out under all circumstances if you become unexpectedly ill or are injured, but to have that information available, you know, in your phone, you know, in case of emergency, you know, that number in your phone, and for that person to know, you know, where to access your power of attorney is a great idea.
Yes, and at the Coalition, we also have wallet-sized cards available that you can complete that give all of that information on them regarding who your healthcare agent is, who your primary physician is, etc. And we can give you one of those cards. You can fill them out and keep it in your wallet, and that's a good way to have that information handy as well. Also,
right. That's a terrific little tool, Gerry. And somebody just pointed out that there are Polst medallions similar to Medical Alert for those who don't carry Polst forms. So, you know, a good example of an alert for somebody that you can wear as a necklace or a bracelet to alert healthcare providers if you have specific instructions.
All right. So thank you to everyone who has attended, and I think we've had some great discussion, and hopefully you have gained some knowledge in regards to advanced. You know that this webinar is being recorded, so there will be a YouTube availability of this if you would like to share it with anybody that you know. And again, on our next slide here, I have to close some windows now. Let's see. Here is the Coalition for Compassionate Care. Gerry, I know you spoke about the web address. All of the documents Gerry presented are available on the website that can be filled out electronically and then printed. And then just to reiterate, Gerry is available as well as Maypaw to assist with any questions should you have them. And then Gerry and Dr. Neeley, if you guys had any closing statements or any last words that you wanted to share.
You know, we stood up the San Joaquin Coalition for Compassionate Care because we wanted people in our county to have access to expert advice. We wanted to spread the word regarding the importance of having agency over your own life and you know, having the conversations and expressing your own wishes for how you'd like to be cared for if you become seriously ill. As you can see, this is a coalition that is supported by some of the most important healthcare organizations in our county. And the reason for that is that this is an incredibly important thing for every single person who lives in our county, every one of our neighbors, the people that we care for. This is something that is essentially always a win-win because it's being cared for in the way that you want to be cared for, and it's giving the people who love you clear direction and resolution as to how you want to be cared for, you know, when the time comes that you have to face those challenges. And so, you know, I hope that you will find a way to support this organization, and I hope that you will also spread the word and get the word out about this organization to your friends, your loved ones, your neighbors, because we're really here as a resource for every one of our neighbors here in San Joaquin County. And so I thank you for listening in today. It was really a pleasure to be on this virtual meeting with Francis and Gerry.
Yes, thank you. And I'd also like to add, certainly 110% agreement with what Dr. Neeley has just stated. I'm just going to take this opportunity to give you my phone number. so that if you need to reach me before we're all back in offices, you can. And that is at the Coalition, 209-444-5908. Feel free to give me a call there at my office number. It'll get to me on my mobile, and then I can discuss and assist you with any advanced healthcare planning needs that you might have. And if I can't answer your question, I will point you in the right direction. But I'll be sure to do my best for you. Thank you.
Excellent. Thank you so much.
All right. And again, thank you for all tuning in and joining us for this webinar. I hope you guys all have a fantastic day.
Thank you all.